it's Dr. Anthony G. Beck, and I figured I would go ahead and take a little bit of time and make a video, particularly from some requests that I actually got from a lot of the members in the Balanced Nation Facebook group. So now I originally was going to set this up, truth be told, to stream live to the group. But for some reason, Facebook tonight started to be a little weird. Maybe because it's all the truth bombs that I've been dropping over there about the coronavirus shenanigans and the COVID-19 goofiness. Anyway, so if you've been hanging out in Balanced Nation, you know I've been critical of what's been going on there, but also trying to give a tremendous amount of comfort amongst all this hysteria that I'm sure we're all able to admit that that's what it is. So needless to say, what I wanted to do is put together a sampling of some of the remedies and methods that I actually use to teach some of my patients or clients how to resolve respiratory complaints that are generally associated with things like colds, flus, or other recoveries, because sometimes even in the medical community through different surgical procedures and whatnot and general anesthesia, sometimes people have some secondary respiratory issues. So I want to show you how I kind of do some reliefs. Now the big thing is this is not a master class. It's not designed to take you through everything and every tit and tittle, but just to arise your faculties so that way you can get a good idea of some of the options that you do have. The second thing is I also want to clear up some of the myths that are kind of going on out there. One that I've seen here recently about COVID-19 treatment is the use of a hair dryer for the sinuses, which is relatively true, but I saw the little video that was going around. It was actually incorrect. So I'm going to actually teach you the proper way to do that method. Okay, so without further ado, kind of going from my right over here to my left, I'm just going to kind of show you some of these devices and machines and things that I have, okay? The upshot here is this: whenever you have an upper respiratory distress, it's really important to make sure that you keep the nasal passages and the respiratory moist or hydrated, but not too hydrated, because you don't want to put a tremendous amount of moisture into either of those and kind of make the situation worse, okay? So there's a little balanced understanding when it comes to that. One of the big things I want to let people know is that the super simplest way to correct for your environment to be non-conducive to microbial effects to the upper respiratory is to maintain the proper humidity percentage in your home or office or bedroom. Now, this sweet spot is 50 to 55%. Now, because I have a whole bunch of studio lights here and things like that, it gets a little hot in here, so I cranked up the air conditioner just to sacrifice for you guys. But anyway, so I'm right here, I'm sitting at 47% humidity, which is below the ideal level, but it doesn't really create a stress too much if it's just a short period of time. I was at 52 earlier, so that works out fantastically, okay? So the upshot is you can actually get this little hygrometer to take a look at an ongoing count. It brings in air in the back and turns out there's a little bit of fan, and this will give you a good read consistently of what your humidity is. Of course, you can see it actually going up 3 percentage points because it's probably getting the moisture from my breath. So really good device. You can get these anywhere. They're just a few dollars. They're not super expensive or anything like that. So tip number one, grab you a humidity meter so that way you can keep between 50 and 55%, okay? Next thing of that nature is to maintain humidity. I like to use one of these cold atomizers, right? So, or the thing is this just doesn't have any temperature. I call it cold because it's not a heat humidifier, okay? So there's various temperature devices out there. Some are going to be cold mist like this. Some will be heat generated. I'll show you this one here in just a second. But this is one of my favorites just to put into a room, particularly here in Florida in the wintertime. Believe it or not, it does dry out. The humidity is not year-round. So the thing is this has a big reservoir, okay? So this fills up with water. You put that in the bottom. You put this little carrier on top of it like that, and it works out fantastically. It is ultra quiet. I'm talking about this thing just doesn't make any noise, okay? It is fantastic. So you can adjust it on the front a little bit or a lot. So that's one of the other things is to use a device like this to keep that humidity between that 50 and 55%, okay? So the next thing is let's say you've already gotten to that point where you're starting to have some upper respiratory troubles either in your sinuses or in your lungs. Well, the first thing we want to do is to apply some medicinals that aren't pharmaceutically required. All of these are designed to actually give you options on your own, dare I say, a home remedy kind of a thing, okay? Well, the first thing I like to do is kind of start from the top down, and one of the best ways to do that is to first of all prepare the sinuses. So if you're clogged up and you have that congestion in there, one of the techniques is to take a breath in your nose and then out of your nose and tilt back and forth. And then when you release, breathing in your nose, breathe out your nose, do that again. And a few cycles of that, and you should start to feel your sinuses open up. It's really as simple as that. But sometimes you need a little bit of help, and you have to be sitting there bobbing your head all the time. Well, one of the best ways to do it is to go ahead and irrigate the sinuses. Now, one of the famous ones out there is the neti pot. You've probably seen that. It's like a little pot, and you stick it in your nostril, and you lean your nose over the basin, and it flows through, and you do the other side. Well, that's kind of cumbersome to me, and I think with technology we can improve upon that. So one of the things I will reach for is this little device right here, okay? I'm even sticking up my nose for you. Okay, so this is the Navage. Basically, you have a tank up here that you fill up with water, and it comes with these little salt pods, okay? These little things here, this device can run somewhere between $75 to $100 depending upon where you buy it, so it's a little expensive. And then they send you a good amount of these little salt pods, and they look like this to begin with. Okay, there's a little aluminum foil like that, and then what happens is you open up this top, set this here, and you put this down in there and you crush it, and it dumps the saline solution down into here. Now, one of the problems with this device is once it's got some little toggles in here that's designed to make you buy their pods. So it's really a one-time use thing. But the thing about this is once you close that down and you pop it back up, because let's say you put the pot on, but then you're like, oh crap, I forgot to put any water in there. It's happened to me a couple of times, especially when your nose is all jacked up and you're just, oh gosh, and trying to deal with it and you're not really thinking in your right mind. That happens. So fill it up to the water line first, okay? You can see that there on both sides. Then you'll put your pot on there, crush it down, and then what happens is it unlocks this button over on this side. So you can see with it nothing in there, the button won't push. Once you pop the saline solution down into it, it actually will activate. But I'm going to show you a little bypass for that, okay? So what you'll do is you'll stick the pot in there, and then it crushes it down, and as you'll see with that used pot, it won't use it. That's because it pushed down a piece of plastic in here. But the good news is, okay, if you set this down inside of there and then take your finger and push this little button right there, okay, and then ease it down, okay, the machine will tend to work, okay? So, of course, here I am doing this on camera, and it's not rocking and rolling, but we'll get to it. Let's see here. Okay, whoops. Okay, so then now it will work. So that's just a little bypass, because you can make your own saline solution, because buying these pods over and over and over again, I just really don't think that's fair for Navage to cause people to do that, especially as expensive as this device is, okay? And basically what it does is it's going to push water into one nostril and suck it out of the other. And so this device here has an ability to change nostrils. Do you want to go in one and out the other? Whichever's more comfortable. But sitting there and putting that in that bad boy and sitting there and learning to breathe while it's going through your nose, you can talk and things of that nature, and it's pumping out of here, going in one nose, coming out the other, and collecting all the snot and boogers and fun little science project down in the bottom tank. So Navage, it's phenomenal. I love it. But sometimes you need a little bit more oomph, if you would, when it comes to something other than saline, okay? So saline is just water and salt. So if you want to make your own saline to pour in here, it's really simple. So it's 1 cup to half of a teaspoon of a sea salt. Don't use iodized salt or anything like that. You can use kosher salt, but a nice sea salt would work well for you too. Okay, so 1 cup to half a teaspoon of salt, and then that makes your solution. You're going to do this a few times, so you might as well go ahead and double that and make like 2 cups of water with a teaspoon of salt. Put it on the stove, warm it up, dissolve the salt, let it kind of come to room temperature, because if you push, you don't want to put hot water through your nose. That's really not a good idea. That's, if you use to dissolve. If it is a temperature, which I'm getting ready to share with you here in just a second, it's actually very beneficial, okay? But it is interesting to be putting hot liquid through your nose. And this is one of those caveats, right? Where, you go on camera and, oh my God, Dr. Beck is telling people to put boiling water through their nose. No, there's a temperature variance in there. So you can handle certain temperatures, and I'm gonna talk about those temperatures here in just a second. Okay, you just don't wanna put cold water through there, because that'll just make your sinuses like you just, had a Slurpee drinking contest. So in other words, you'd fill up this saline solution is basically what it is. You can use the pods if you want, or you can make your own. I've given you the recipe for that. One additional thing that you can add into, this is a product called Alka-Time for fast, effective relief. Alka-Time, there's also a glycolol version of it. And basically what this has inside of it is water, glycerin, ethanol, sodium bicarb, sodium borate, right? So that actually is a borax. It's very antimicrobial. It's very soothing to the mucosa. Sodium salicylate, methyl salicylate, thymol, eucalyptol, methanol, okay, menthol, excuse me, not methanol, menthol, and pine needle oil, okay? So you can use this as a gargle, in your mouth, swish and gargle the throat and all that sinuses, so you can do that. And you can also put a little bit into here. So I recommend you start with like a half a teaspoon. You can mix that half a teaspoon in with the saline. Those two work exceptionally well together. But if you really want to have a nasal opening experience, you can go up to 2 tablespoons. I've done that. It's just all a matter of tolerance. So it's a matter of comfort, okay? So getting used to using the Navage device takes a little doing. So I definitely would recommend that you practice with just saline solution first before you start dumping other things into it. After you've done that about 4 or 5 times and you know how to master the device, then begin to add other things to it, okay? So hopefully that makes sense. So bathing the sinuses. Now, one of the things that I do also find very useful, because remember, we don't want to be dogmatic and we don't want to just think that, hey, everything just has to be absolutely natural, is to use a nasal mist, okay? So this is a medication that's over the counter. It's called oxymetazoline, and basically you guys have probably all seen these, and it's just, a couple of mists up into the nostrils, one in there, right? Breathe in, foop, foop. You can hit 1 on each nostril, not a big dose. Give that a second to open them bad boys up, and then follow up with the Navage irrigation, okay? And talk about the relief from the sinuses and everything like that. It is a game changer, especially if you're having any other type of physical complications like malaise or muscle soreness or nausea or things of that nature. Things can get a little gamey. So don't be afraid to use over-the-counter medication, nasal spray, to open them up so that you're not having to do all your head bobbing all the time. Irrigate it with the Navage with water. Add something like a glycolol or a Alka-Time to it, and just work that through. Keep it bathed. You could do that 3-4 times a day. I think is more than enough to kind of keep that open and rocking and rolling. Okay, so keeping with the theme of working on the nasal passages, because this is really where things actually start to happen. For the vast majority of people, if you have some type of upper respiratory or lung congestion, or any kind of like soreness of the throat, it generally came in the nose, which is one of the reasons why the test kits for the COVID-19 are these cotton swabs. Now remember, I've talked about this particular test and me not being a fan of it in other videos over on my YouTube channel. So if you want to check that out, you just head over to youtube.com/balance protocol. Now this video will be on that channel, so you can look around for it, but sometimes this might be on other platforms that other people are sharing. And so I want to make sure you know where to go and find that. So I've talked about the coronavirus hysteria, try to give everyone a bunch of, calm and sensibility, reasonable understanding of what's going on, because it's just, we need that in times of this nature. It really is conflated. But the upshot is that I am not a fan of the COVID-19 test kit, because basically the kit is swabbing your nose for a really small fragment of something called RNA, and then they actually take that, have to put it through some various reagents, amplify it, and do what's called a polymerase chain reaction, or PCR test, that supposedly that piece of RNA is part of a protein that is part of this particular viral body. There's just lots of problems, and it's riddled with errors. And I think one of the big problems that we're going to have is a lot of people are all hyped up in hysteria, just like they are going and hoarding toilet paper, for goodness sake. They're going to be going to these drive-up places and being tested because they're just freaking out, and it's free, so why not? You can't go to work or school, why not drive in the car and go do something excited and have some stranger in a hazmat suit drive a little Q-tip in your nose? So I don't like it. I think it's completely flawed. It's not something that I recommend that you do unless you've got symptoms and you're presenting to a medical facility, and that might be, there are cases where I think it could somewhat be justifiable as part of the diagnostic. I just don't think it should be the only part of the diagnostic. So on that note, I just want to make sure I put on here that this is not intended to be any type of medical advice whatsoever. If you have signs or symptoms that are bothering you, then definitely touch base with your physician or your primary care doc or provider and see what's going on. I know for me, I've been doing telemedicine since 2009, so I have a completely virtual practice, and I see patients all around the world, and these are some of the things that I'll just jump on camera with and show them how to do. So I figured I'd go ahead and put this out to the world and see how that works. So telemedicine can be a very effective thing. Now, it has its downsides. Keep that in mind, because nothing really replaces the hands-on examination and being able to see all the things that make up your particular case, being able to look into the nose and throat and ears and blood pressure and respiratory rate and quality, and then take a look at your blood pressure and heart rate. There's all kinds of things, okay? So it has its place for little acute things. But if you do have things go south, and don't be afraid to seek competent medical care, okay? And for those of you guys who are my followers and things like that, I tend to be, more on the natural side of things. But let's not poo-poo medication. In acute cases, you want to maintain life. So don't be dogmatic about being scared of medications, because sometimes certain situations that are upper respiratory or sinus problems are related to bacterial overgrowth, and you might need an antibiotic to be properly used. If you do, always follow up with a very significant course of a very high quality probiotic. Stay away from those soil-based organisms, not a fan of that. But anyways, okay, so those are all the disclosure in that. We talked about the nasal irrigation part and some of the options there. Now, one of the next things is this particular face steaming device. Now, this actually is, I don't have no affiliation. I'm not going to give you any affiliate links to any of this other kind of fun stuff. I'm not going to put it in the description below or any of that kind of jazz. Go look for it. Do your own research, so that way there's no monetary issues for some people thinking that there's something of that for me. Anyways, so this particular device is a hot steam, or a hot humidifier, but it only has a very small tank that you fill up with water. Okay, this goes in the back. Okay, it heats up relatively quickly, so I'll talk here a little bit while I crank it all the way up, and we'll see how fast this comes on. One of the things that you want to do is get the nasal passages not only clear, both noses, and with big old nostrils like mine, we got to get that done. I've become an expert at doing that. Thanks, Mom. And the thing is we want to put warm or hot, some people would say moist air into the sinus cavities of the face, particularly as a preventative, because it can really disrupt microbes that are starting in there. It will increase the mucosal secretions that are protective, and they have antimicrobial properties just built in. Part of your immune system. This is why you can't take necessarily supplements to boost the immune system. And so on that note, let me do a little tangent while this is warming up. Be careful of the bloggers, the influencers, the biohackers, the functional medicine docs, and all those who will put out memes and say, and give you a list of herbs or supplements that are antiviral, okay? Like I saw, a lot of them are putting out zinc. Well, zinc has a last name, and depending upon, what the type of zinc it is, will determine its method of action, its target tissue, and its effect on your body. So you just don't tell people to take zinc and then send them off to the lone and dreary world of the supplement aisle at a vitamin shop or a GNC or a Whole Foods, and you just get whatever zinc is on the market, okay? Because there's a huge difference between zinc monomethionine versus picolinate versus orotate, aspartate, oxide. There's a lot of different ones. So if anybody ever makes a recommendation, I understand that there's some of my colleagues out there and they give a mineral without the last name, they don't know what they're talking about. Number two, the dosage guidelines should be there, and then how long you should dose them should also be in there. Just don't start taking them, because you can drive an imbalance in your body from taking something that you presuppose has to be some type of benefit because some random influencer on Instagram or Facebook said that you should take it. Okay? So there's that. Same thing when it comes to herbs. You got to be very careful, because the immune system is not a one thing, okay? There's all kinds of components of the immune system of the body. It's a system. Various organs are part of the immune system. And of those organs, various tissues are part of the immune system. And then cells within those tissues of those organs of those systems. So it's not so simple. You can't just say, hey, just take a bunch of, medicinal mushrooms or this herb or that herb. It does not work like that. So I would prefer to have you swim in this particular area, okay? As far as the immune system is concerned, if we want to talk about the whole body as an immune system, we have things like sunshine, UV light, fresh circulating air, proper hydration, rest, getting connected to the earth and barefoot out there so your body electrical potential is there. All those things are far better for you than taking things like elderberry extract and all these other different things, okay? So, you see how long this one took to kind of get cranked up, okay? So I started to see the initial steams coming out of that. So in the meantime, as it's still beginning to crank, let me talk to you about another thing. This one is a company called Omron. That's just the one that I've had. This is a really portable one. It has to be plugged in because it doesn't have a battery pack, so that's one of the downsides. But this is called a nebulizer, okay? And the cool things about these is we use these in medicine to deliver medication, okay? So basically there's this little tank in here, and it's the same thing as this device here, okay? So as this sits there and pushes that out, this is kind of we could call this a nebulizer. It grabs whatever medication. Sometimes we'll put steroid in there. If you put a few drops of normal saline in one of these, okay, you can actually add some essential oils to it, right? Now, some of you guys that are into essential oils and so forth you have those little nebulizers. So you can actually put your face over those or get your nose in there and deliver those. But be careful when it comes to essential oils, because they can also be very irritating to the mucosa of the nose and the lungs. I'm particularly not a fan of Dr. Axe or his method or the recommendations that he makes. I think they're not well put together or correct. So there's all kinds of other bloggers and health people out there. So you got to be careful. And I can't go getting into every single aspect of everything like that. But I will kind of give you a couple that are relatively safe, both for adults, kids, elderly. One of which is Melaleuca alternifolia, which is also called tea tree. So I'm a big fan of that. And you can go with a good quality company like Young Living Essential Oils or doTERRA. They do put some very nice oils out there. Some that are in the health food stores, not so much. Because you really can't trust the quality of those. I've been doing medical aromatics for 20 years, so I really get that there's a difference in quality, but again, I can't make this a master class to get into that. But just a little drop goes a long way. So if you put it into a nebulizer on top of water, it's going to foam up like this, okay? So more is not better. It's better to hit it repeated doses over the day. So again, 3-4 times a day, separating it by about 3, 4, 5 hours is a good way to do it. So a little bit of normal saline that you can make on your own. I'll put it into a bottle like this and be able to use that, just pour it out or mist it. There's a couple different applications on the skin that I'll do. You can buy saline nasal spray at most grocery stores or pharmacies, okay? So you can actually take some of this nasal saline, squirt it into the nebulizer, 1 drop of Melaleuca alternifolia, and then actually inhale it. That's what this is for. And it's got a little flap so you can breathe out. So these are really cool. You can get all kinds of nebulizers online. They're somewhere around $30 to $40. Those are really nice to have because if you're tired or laid out in bed, it's nice to just have, you know, somebody who's caring for you, or if you're sequestered, and just be able to make it nice and easy to deliver that. Okay, so now that we got this bad boy steaming, okay, whoo, it gets hot. So the thing is as your face is designed to be over this, okay? Now this is great, you know, and the ladies normally do it more than us guys, but I've been baptized to the faith of good skincare, being in the anti-aging world. And so the thing about it is this is designed to open up the pores to deliver medications or facials or squeeze out blackheads and all kinds of fun stuff like that. However, it puts out a very nice, moist, and hot delivery of air. So what I have is I have a little laser meter here, and what we can do is we can test this bad boy right there at what this is, and I'm at about 137, okay, 137. And that's about where you want to be, somewhere between 130, 140 tops. For instance, another option to do breathe in hot air is a sauna, right? So I know that my far infrared and near infrared combo sauna gets up to definitely 140 degrees. But the thing about it is you don't want to just be in dry heat for this particular area. You need to add some moisture to it. So that's why I think this is a, you know, big bang for the buck, to just get up in here and bring that in there. It's hot, okay? So you want to, and if you don't have to be on it constantly, you can kind of come in here for a little bit and come out, come in and come out. But, you know, a good, 10, 15 minute treatment, go through one of the bottles of water that's in here. That's kind of how you know if you've done enough of it. On these devices, you cannot add essential oils or saline, so it has to just be either reverse osmosis water or distilled water that you put in here. I don't recommend that you breathe in tap water because there's a lot of pollutants and contaminants in here that you usually don't want to be sticking into there, okay? If you are wanting to get more moisture, you just use one of these normal saline sprays, okay? This is one of the pressure ones. It's not like the pump, like the nose spray. But again, if you need to open it up first to get it all in there, don't be afraid to use over-the-counter nasal spray. Back it up with some nasal saline, get it nice and moist, 2 or 3 pumps into each nostril, okay? And then apply the heat, okay? So that's the other option. Now, the other one, and this might get a little bit loud, is a hair dryer, okay? Now, this one is a professional one, provided by the world's greatest hairstylist, Erica, here, who takes care of my family's hair. We'll shout out. And the cool thing about this is it has a warm and a cold and a hot switch on it, and a low and a high. A lot of other blow dryers are just on, right? So you got to be careful. So the thing about this is if I turn this on, okay, you can get and if you've got this type of nozzle, you can just come at the side and breathe it in. If you have one that's kind of hauling butt, okay, you can slow it down by covering up the back end, and it cuts it down just a little bit, depending upon the power of the dryer, okay? So, for the sake of the noise on the audio with my mic and everything, I measured this one earlier, and this one can definitely get up into that 130, 140 range. When it's on high and it's really cranking, it's up around 160. That's a little uncomfortable to breathe. So be careful with that. If you have a thermometer or you want to invest in a little laser thermometer, these things are the cat's meow. It's really nice. They're, the cat's meow. 35 bucks or so, something like that. And this one is a ETEK City, ETEK City, all right? It's great. But you can use a blow dryer, but there's the little clip that was going around, particularly for the coronavirus, they were misting the face and then blowing it. that's just going to dry out your skin on the outside. So I think that's erroneous information, okay? That spray bottle really doesn't get up in there well. So I also believe that if you can get some sodium chloride up in your nasal cavity as well, that has a very nice property to it to get the mucosa to equalize and wash out, okay? So if you're gonna use the hair dryer method, okay, got to play with it. It's not necessarily for the faint of heart. Spray a couple of these up in your nose. 1, 2, 3, 1, 2, 3, or so, whatever's more comfortable for you. Turn this thing on, and then just kind of take it from the side and come in and rest a little bit, come in and rest a little bit, okay? So a hair dryer can be very useful. If you don't have one of these tips, it makes it a little bit more aggressive. So you kind of just have to kind of find a place somewhere between your nose and the end of this of where it's comfortable, okay? So it's a little doing. Okay, listen, this is just a recommendation, all right? So you don't swim at your own risk. There's no lifeguard there available for you. But hair dryers are an option to add 130 to 140 degree air into the nasal cavity to warm it up. But don't forget to have moisture in there, preferably with normal saline. That's the take home on that. And again, you can actually prep it with the oxymetazoline to get that opened up and then to put that bad boy in there, okay? Next, one of the other essential oils that I like to use to kind of break up congestion and mucosa and stuff like that is grapefruit or Citrus paradisea, and just another drop of that. So you can actually put a little bit of that into your nasal saline. Now remember, oil and water don't mix, so you'd have to do it very vigorous and shake it, deliver it. Okay, so there's an option. Again, you can add the alkatime or the glycolol into your normal saline that you're spraying up into your nose, and then apply whichever heat method that you would like to apply. Okay, you kind of get the point. All right, so one of the other things is if your lungs begin to feel congested, one of the great little supplements that we have is NAC or NAC, N-acetylcysteine. Now, I've seen even some people out there in those stupid little memes of these things that boost the immune system talk about N-acetylcysteine like it's not, like it's benign. Well, it's not benign. It's a very useful molecule, and it's powerful for breaking up mucus, okay, both in the bowel and in the lungs and in the nasal cavity. But if you take too much or go too long, it can dry it out and make the problem worse, okay? So there's that balanced understanding. The dose typically for an adult is somewhere around 500 to 1,000 milligrams, BID or TID, okay? So that's twice to 3 times a day. And generally for maybe a max amount of about 14 days. So the length of the typical time that someone would have this particular upper respiratory, you'll be fine. What I don't want you to do is just keep taking it as a dietary supplement, as a preventative or an immune system booster, or to boost glutathione in the body, because it does. It also does that. But what I don't want you to do is just always have that in there, because it can dry out mucosa, okay? Even, I mean, like systemically, it's pretty amazing. You can even do it down there for the girly parts, ladies, so be careful about that. So N-acetylcysteine is a nice option as to present. One of the other ones that's pretty famous out there is a blend called Thieves, right? So this is a combination of clove, lemon, cinnamon, eucalyptus radiata, and rosemary. What I like to do is I have these little bottles, and I'll actually send these to my patients, and I'll do an equal part of distilled water and a mineral spirit, okay? You can actually go vodka, you can go gin, you can go tequila. The other thing about that is you can use a rum, anything that's got an alcohol content to it, somewhere around that 40 to 70%, and the rest is water, so you'll cut that in half. And then what I do is for this whole bottle, I'll just put in 10 English drops, okay? So these are larger drops, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Put this back on here, and basically this makes a nice little spray for the whole mouth. I travel with this, so whew, that's nice. If you're going on an airplane, this is really good to put a couple squirts in there before you go on. Believe it or not, you can actually even put on your palms. Talk about a hand sanitizer. This is the way to go. Hand sanitizer that's glycerin based, Actually, once the alcohol evaporates, that glycerin stays on there, and that's food for microbes. So I do not recommend the Purells and that's just a name brand, you know, no ad hominem on them, but any of those hand sanitizers that everybody's buying up like it's gold too. Not a fan. Wash your daggum hands, okay? 20 seconds or longer, soap, warm water, rinse, rinse, rinse longer than you think, and then mechanically dry them off. I can't believe the whole world's had to learn that lesson. Maybe that's because, you know, the school stopped having home economics. Don't get me started. But anyways, this little spray bottle with some thieves in it or some essential oils to your liking is a really nice option, 1 or 2 sprays and to put it on your hands, and it smells real good. I'll even take a little bit on my finger and I'll actually put it on inside of my ears, right? So that's another microbial input. As long as it's not too strong, it's not gonna be harsh. For adults, be careful with kids. If you got a little Johnny or little Susie and you hit them with this, you're gonna light them up. They're not gonna be very happy, okay? So that's a preventative. You can put it on your hands, you can put it on your ears. It's really awesome. Okay, the other thing is, when you are sitting there and relaxing, some of the really good things to do is to use acupressure. These are acupuncture points that we use in traditional Chinese medicine. The same oils, now thieves can be a little strong to the skin. Some people can take it, but I like tea tree oil is a good place to do it. So some of the best places, and again, this is not a master class, so I'm not showing you charts of all these things, but one of them that's called 1.5 sun or measure away from the, or what do you call it, distal from the crease of the hand is lung 7, okay? You can push and massage on lung 7 because you're sitting there laying there relaxing. And that point is a great energetic point for the lungs and respiratory. The other one is what we call the Shu Mansion. So if you take the where the V comes down on your throat and then just over and under the clavicle, your collarbone, those 2 spots there, those are great to massage. Okay, so right here. Okay, anywhere on this line underneath that clavicle bone, and sometimes, actually for the most amount of people, if you have a lung upper respiratory issue, this is going to be tender. So then we call that in Chinese medicine ashi. Like, ashi, that hurts. A-S-H-I. But anyway, so the thing is we call it that stomach 13, but instead of trying to find the point, you can look those up online. Just down along the edge of that clavicle, all the way from it starts all the way to over here to this point, okay? That's a good place to massage, and you can do it on your own, okay? Really easy to do and massage. The other one is just to the lateral and even with the, your nostrils to where you just sit there and you mush, okay? So that is large intestine 20, and then that little place at the head of your brow, bladder 2, that's another place to push. So between here, maybe yin tong, and along that lung line and on here is great. Large intestine 4, that's at the mound of the web of your hand. All of those are the command points for the head, neck, face, and the lungs. Works really well. So you've got acupuncture points that you can use, acupressure, okay? Then there's reflexology on the lung points of your hand. That actually works really well. You can look those up. But particularly if you're going to use essential oils, like I said, I like tea tree. I also like eucalyptus globulus and also rosemary officinalis, because both of those have cineols in them. And those cineols are not only antimicrobial in properties if you get us to a certain level, but they're also mucolytic as well. They break up mucus and they do all kinds of fun stuff. So stick to those. Don't go slathering on all kinds of other essentials just because they sound good in principle, okay? Now, last but not least, a little bit of something to swallow and keep things moving. This is where I bring in my masticating juicer, and I use lemons and I mix it with Manuka honey, okay? So this is a essential oil infused honey. Thank you, bees. So it doesn't taste like normal honey. If you've never had Manuka honey, this is not the same. It's not appealing to a lot of people. I actually enjoy it. But the tip on this is that when you use a lemon, get organic lemons and just wash them off gently. Don't use too much stuff to clean it off. If they're organic, it's not that much of an issue. But send this whole thing through your juicer, where you have a centrifugal one or a masticating one, it doesn't really matter. You want the essential oils in the rind, okay? Delta limonene chemical is remarkable for so many things when it comes to what you're dealing with upper respiratory. It smells good, it tastes good. You've got that natural ascorbic acid. It's a natural C, not that ascorbic acid, which can be used clinically, not too high of a dose and not for too long. That's a whole nother subject. But whole lemons, okay? So basically what I'll do is, and every lemon's a little bit different, right? You roll these, get them a little warmed up, run them through the thing, see how much you have. So now it's lemon juice with lemon rind and all the oil that's in there, okay? So typically I'll take that and I'll mix it in for every ounce of lemon that I have here, I'll do a teaspoon of Manuka honey. Okay, so then a little goes a long way. So basically what I'll do is I will take a half a teaspoon of that, and I'll have my patient dose that every 2 to 3 hours prophylactically. Okay, so Manuka honey and whole juiced lemon. All right, so I think I covered everything. I think that's it, right? So the whole take home here, I hope this has been very useful for you, is to just empower you with some mechanisms. Don't forget the power of sunlight and getting out in the fresh air and sunlight at the same time. Not too much, but listen, I can't tell you how important that is. I mean, hospitals back in the day, they knew that. It was super important. These sanitariums, if you will, it was absolutely critical. Keep your nose and your sinuses irrigated, and you can do some of these things I showed you here prophylactically if you want to avoid that. I know before I ever travel, I'm going to prep my nose area, get this big bad boys all cleaned out. And then when I get back home, I'm going to irrigate and I'm going to clean all those as well. So some people will actually take these with them when they travel. So you can do that when you get your hotel room and things like that. Knock yourself out. It's completely up to you. A lot of this is very portable. Just make sure you pour the water out and stuff. Don't put that in your bag. I had a patient do that one time. But maintain your humidity levels. Use your acupressure points. Use your reflexology points. Work with essential oils properly. Don't be afraid to use a little bit of the medications and the salines and stuff that are already prepared out there, and it will do you an absolute world of good. Now, the big thing is also to remember, and I'll part with this, is that these are some self-care things that you can do, okay? These are home remedies, if you will. It's not to be intended to be medical advice. Don't fool yourself. If you get into a difficult spot, seek medical attention, even through telemedicine if you need to. One of the things I would love for you to do if you enjoy this video and it's over on my YouTube channel that you're seeing it, that'll be youtube.com/balance protocol. You know how this works. You've seen us all out there. Comment, like, subscribe, hit the notification button, and then cut and paste that link, share it with people, right? So I know a lot of people are going to be in their homes here for the next several days, so this would be a little cool thing to do. I do know that there's various online ordering systems where you can actually shop for a lot of these things and get them in there. What I'd love to do is, if you do use any of these things that you've learned today, tag me. Just mention me out there in social media. My Instagram is @BalanceProtocol or @Dr. Anthony G. Beck, either one of those. And let me know how it works out for you, okay? So instead of doing all the silly stuff that's out there, these are things that are actually very useful. Let me know how they work for you, good, bad, or indifferent. And if you have any questions, you can come over to facebook.com/groups/Balance Nation. That's facebook.com/groups/Balance Nation. Come join in the movement over there. You can ask me questions and it'll be fielded by me personally. No bots or assistants and things of that nature. I'm going to post this in there. So Balance Nation, if you're watching that, I love you the best and I appreciate your support. And until next time, remember to live life in balance. And this is one of the ways it helps you do it when you get out of balance when it comes to sinuses and upper respiratory stuff. Fear not, this coronavirus thing shall pass. We'll be free and clear for the vast majority of the planet come May. I've already said it in multiple videos. That's the way that works, okay? We've got some work to do to recover the economy and our lifestyle together, but keep a good mind. You know, get that morphic field, that morphic resonance going in a positive manner. And if you need a little dose of that to keep you sane and keep you from crazy, come over to facebook.com/groups/Balance Nation, and that can be a new home for you to do exactly that. Let's have you live life in balance. Love you guys.